Welcome back to Western New York Living. Now, imagine if you wake up every morning with burning, biting, stabbing, even shooting pain in your arms and legs. Even worse, if you experienced a loss of sensation in your feet, ankles, or toes, which leads to difficulty even getting around. Well, close to 20 million, and some even estimate possibly 50 million Americans and Canadians, this problem is real. And it's called peripheral neuropathy. Today, we're lucky enough to be joined by one of the leading experts in treating this disorder. It's Dr. Chousky of the Chousky Centre, located in Toronto, Canada. Dr. Chousky, thank you for joining me.
Thank you for having me.
I know your approach for treating this debilitating condition is with technology and not with pills or drugs. Before we get into this, what exactly is peripheral neuropathy, and why haven't people heard of it?
Well, if you had it, you would have heard of it. Peripheral neuropathy means outside the brain and spinal cord. Neuropathy means nerve damage or disease. So what we're talking about is damage to the small fiber nerves, and through insult or injury, and in the presence of poor circulation, these nerves can become necrotic and die. These small fiber nerves send communication between the body and the brain and back again. This disorder we refer to as what we call a stocking and glove disorder. So when we talk about peripheral neuropathy, we're emphasizing the nerves in the hands and the legs and the feet.
Dr. Chousky, your description sounds quite painful. What is life like for somebody suffering from PN?
Well, it's really on the low side of awful, because you see, pain permeates every level of their existence. There was a study recently done that demonstrated that the people living with peripheral neuropathy pain is much like somebody living with cancer, Parkinson's disease, or diabetes. So their quality of life is extremely low.
So, Dr. Chousky, from what you just told me, how does someone get peripheral neuropathy, or how do they know they have it?
Well, because we're dealing with very, very small microscopic nerves, based on their size, there's a host of conditions that can contribute or cause this problem. So we're talking about conditions like diabetes, the sugar spikes. About 50% of diabetics run into this issue. People that have been subject to chemotherapeutic drugs, they are neurotoxins. Again, it's estimated at some point up to 100% of chemotherapy patients may experience neuropathy. People have things that impact the spine, things like spinal stenosis, arthritis in their spine, bulging and herniated discs. And perhaps many people don't know this, but the #1 prescribed cholesterol medication, a group called statin medications, can contribute or directly cause up to 30% of all peripheral neuropathy.